I am Annlee-Taylor Glass-Hicks, and I am a PGY3 internal medicine resident at Texas Health Harris Methodist Hospital in Fort Worth, Texas. I, along with one of our assistant program directors, Dr. Morgan Fairweather, undertook this quality improvement project to analyze whether Handoff, in addition to the known benefits of improved patient care and reduced medical errors, also provides tangible benefits to the residents getting Handoff. Specifically, we wanted to see if it would decrease the amount of time residents spend handling pages, as well as increase their confidence in handling the content of those pages. So the way that we did this is that we had residents on our night float rotation take page logs. An example of that is down here. You can see the first question is, did you get Handoff, yes or no? And that's because residents on this rotation receive Handoff on patients that were taken care of by residents during the day. But there are also some patients on these floors that the residents will not assume their care until the following day, and they will not receive Handoff on those patients. So they act as kind of our own control for this project. We have a start time, which is the time they receive the page, the stop time, which is the time they felt they have addressed the page fully to conclusion, and then they record their confidence level in handling the page on a Likert scale from 1 to 5. The data that we received in the last few months is on 281 pages, and those pages were received by either PGY1 or PGY3 residents. As you may expect, PGY3 residents were faster, and they had increased confidence in handling page, which is expected with their higher level of experience. Interestingly, when you just divide pages regardless of resident level by did you receive Handoff or did you not, there's no difference in elapsed time or confidence level. But then when you break it down by resident level, and what I'm about to talk about in this graph here in the middle, for PGY1 residents, if they received Handoff on a page, they spent significantly more time addressing those pages. And for PGY3 residents, if they received Handoff on a page, they spent significantly less time handling those pages. So there's this differential impact noted. Other significant data included that pages received during peak hours, which were noted to be 7 and 8 p.m., took longer to address than those received at all other times of the night, suggesting that perhaps page volume is what is resulting in a delay in response. So when we kind of thought about where to go from here, or why this is happening, we thought about, well, there's a benefit of Handoff for PGY3 residents. They take less time for pages when they get Handoff. So there's a tangible benefit there for them. There is not a benefit for PGY1 residents, and it suggests that maybe when they get Handoff on a patient and they have this increased depth, more information on someone, they take more time to analyze the problem. And maybe they're not able to do that on patients they don't have Handoff on because they only get that surface level understanding from just a quick chart review. And so this kind of suggests that perhaps we need to tailor our Handoff strategies, our education for the different residency levels. And it also highlights this is an ongoing project, and we plan to continue to analyze between the different resident classes how each is able to benefit from Handoff. And then we also concluded that perhaps we need to talk to our nursing staff about kind of tailoring pages received during peak hours to only high priorities during that time. That way they can get prompter responses. Thank you for your time.